Hi, my name is Ramon Jones. I go by Sam, which is short for my middle name, Samuel, and I'm one of the nurse practitioner sleep specialists with Neura Health. My clinical background is I practice in sleep medicine as a nurse practitioner. I'm board certified in family medicine. So I've been a nurse practitioner for 8 years now, and I started in family medicine and then really was drawn to the field of sleep. And so my subspecialty has been exclusively in sleep for the past 3 years. And my medical background is that I'm a bachelor prepared nurse for 10 years working in emergency room and ICUs in the hospital setting. And then I did my master's degree in the family nurse practitioner program and am board certified in family medicine. And like I said, moved into the sleep specialty. Probably be obstructive sleep apnea simply because my background training is in family medicine, which focused on the overall health of the well-being, such as weight, blood pressure, diabetes, etc. But sleep is integral to that, and obstructive sleep apnea very much is affected by weight and other health factors. And so being able to integrate my background and then more specifically towards obstructive sleep apnea, that's made that probably my preferred condition within the field of sleep. I think the most important thing that I really strive for with each patient is to first and foremost just allow them to share everything they feel they need to share and to make just a genuine human to human connection so that they feel that they've been heard, trust me with their health and their concerns. I don't think you can have a successful healthcare outcome or relationship unless you've established that trust and that rapport. So I want the patient-centered approach always to start with first and foremost letting them know that I'll hear them out as long or as little as it takes. And then from there, we can begin to build a mutual path forward to managing their concerns. The reason patient first care matters so much to me is that having practiced in the hospital setting for many years and treating many patients there, I think at times they often feel lost in the system, if you will, or many of them can feel just a number in the system. What I've loved being able to implement in my own specific practice, locally in clinic and virtually with Neura Health is I really want the patient first and foremost to just know that they, just for who they are valued as a patient. They're not just a number. They're not lost in a big, broad system, that we really get to know them. We understand their biggest concerns and needs, and that if things change or more needs to be known about what's going on with their life, their entire background, and then, of course, specifically with their health issues, we're here to know all that process. That's really where I start, and that's what I believe matters most in patient-first care.